Hi, I'm Waqar Hussain, Research Fellow at Monash University, Melbourne, Australia. I'm very grateful for the opportunity to talk to you today. The coronavirus outbreak is the greatest public health threat our world has seen in the last 100 years. It has affected millions of families and has already claimed around 690,000 lives. The outbreak has triggered an intensified movement to digitally support our society's health and well-being. Around 41 official mobile applications called contact tracing apps are introduced globally as a technological solution to fight the disease. These apps track people's phones or location data and inform them about their potential exposure to someone who has tested positive for coronavirus. Tracing apps help interrupt new chains of infection transmission and enable authorities to enforce early isolation and lockdowns. The development of these apps was rather rushed given the shortage of time to respond to the pandemic pressure. While the developers did well to quickly push these apps out for public use, tracing apps do come with several issues. Users repeatedly complain about apps' connectivity, compatibility, and unavailability of up-to-date information. For these and other concerns of privacy, personal data security, infringement of freedom or autonomy, and so on, the global uptake of contact tracing apps remains significantly low. For example, Singapore's tracing app managed to reach 37% public penetration rate, one of the highest in the world. Yet, it is far less than the desired 60% penetration rate required for these apps to be fully effective. In Australia, the adoption rate is less than 25%. In Germany, it is 8%, and in France, a mere 2%. And out of the 1.6 million people who downloaded the French tracing app, 460,000 have already uninstalled it. We believe that there is a strong connection between app abandonment of these apps to human value violations committed by the app offerings and how the value concerns expressed by users are mismanaged by the development teams. Our team at Monash University has been studying human values in software engineering for the last 3 years, and we wanted to investigate about human value violations in tracing apps that are being promoted as very valuable for public health and safety. So what are these human values? Simply put, values are things that are important to people. According to Helen Nissenbaum, a prominent scientist in this field, values are properties of things and state of affairs that we care about and strive to attain. For example, you may set a goal to exercise and lose 3 pounds weight, but it would be odd to cite this as value. Instead, the relevant value here might be good health. The social scientist Shalom Schwartz, based on his study of 80 cultures around the world, identified 58 different values and grouped them into 10 basic value categories, such as universalism, benevolence, conformity, power, achievement, and so on. His theory of basic human values is one of the most renowned categorization of values in psychology and social sciences. Values motivate our decision making and they guide the selection and evaluation of products, which in this case are the tracing apps. Values can trigger emotions. For example, feeling cared for and welcomed in a group can make a person feel accepted and happy. Whereas fearing your privacy, freedom, or security getting compromised may trigger negative emotions such as anxiety, frustration, or anger. For this project, we selected contact tracing apps from Australia, New Zealand, India, and Germany. We analyzed more than 2,000 user reviews expressing value violations in the offerings of contact tracing apps and mapped them to the 58 values identified by Schwartz model of basic human values. We also evaluated developers' responses to these reviews and how they exacerbate user frustration, anxiety, and stress. Here is an example of unfulfilled values expectations that led to app abandonment. I will show you more examples of value violations that are linked to mental health later. But in this particular example, the user is unhappy about the risk to her health and safety, privacy, and autonomy due to the app. Please note that unmet value needs has resulted in the abandonment of this app. Similar issues have been noted in our study that lead to frequent app abandonment by other users. With the second wave of coronavirus hitting many countries, people are suffering more and tighter restrictions. For example, due to the spike in the number of infections per day in the last 2 weeks, the state of Victoria in Australia has declared a state of disaster and announced overnight curfews in Melbourne, where I am at now. This increases a sense of anxiety for people who are already under stress. Given the encouragement from the governments and criticality of these apps for public health, millions of users download these apps. However, due to the numerous functionality and connectivity issues, the developers receive an overwhelming number of negative feedback. Users often show their frustration and anger, panic and distrust, and express their concerns about their safety and privacy with these apps. Take a moment to read through this example, where a user expresses anger and frustration due to the connectivity issues of the app. While developers diligently try to fix technical issues, they largely ignore user reviews describing users' value concerns, or they deal with them inappropriately. Let's talk about frustration and issues with the using tracing apps and its link to mental health. Here is an example of a user who is nervous due to the network warnings in the app and is expressing fear for personal safety and security. These warnings could be quite stressful for people and impact their mental health. In this case, the user is complaining about the app's inability to update, which makes him fearful of the health and well-being of an elderly person he is taking care of. Another example of app-related anxiety and stress for its users. Now, let's look at how development teams can mismanage user stress calls. For example, this user comment, clearly considered helpful by another 524 people, does not generate any reply by the development team. These users appear to be invisible to the developers. We saw developers ignoring such critical comments and concerns common to many users. Due to the criticality of contact tracing apps and the need for their high adoption rates, ignoring such comments can be very dangerous. It creates confusion among users and leads to a relationship of distrust among the app users and its developers. Our analysis also reveals that some user comments posted in app stores can be toxic, politically charged, and may even contain false or misleading information that spreads confusion, fear, distrust among the general public. While the positive comments from other users somewhat counter the spread of fear and distrust, ignoring the spread of such misinformation allows conspiracy theories to thrive in these app stores. Fear caused by misinformation increases the stress and anxiety levels of the users and discourages further app uptake. Here is another way how developers mishandle user concerns and are often laughed at or frowned at by the users. This is a typical example of the user using predefined template replies gone wrong. Though done with good intentions to encourage users, it often backfires because often these templates are indifferent, inappropriate, or even inconsiderate of the user requests. Template or automated replies often discredit the information already provided by the user, something that the users find to be inconsiderate, frustrating, and even offensive. It is well documented that expressing empathy in developers' response triggers positive emotions and improves customer satisfaction. In contrast, as we have seen in our study, that inconsiderate replies to users' feedback may cause stress and anxiety for the users and can discourage app uptake. Insensitive communication through apps and related public forums can affect public mental health, especially for those relying on the pandemic information shared in these platforms, like the frontline health workers fighting the pandemic. In fact, inaccurate and insensitive message shared through apps can have potentially fatal consequences for users, and it has been known to induce suicide in teenagers. Based on our results, we are developing a semi-automated tool to support developers in addressing user reviews that flag value concerns. Our solution is able to identify values that are being violated in app reviews given by the users. The tool is being enhanced to help developers prioritize issue fixing based on most critical value violations. With this tool, we plan to guide developers to avoid violating values when replying to user reviews that can have a positive impact on mental health of people using these apps. So the three takeaways from this talk are: human values such as privacy, safety, security, expressed by contact tracing app users, are poorly addressed or even ignored by development teams. Mismanagement of user value concerns negatively impact mental health of the users. Development teams need semi-automated support and training to better manage user feedback to reduce negative impact on users' mental health and improve the uptake of these tracing apps. With this, I conclude my talk. Please feel free to reach out if you would like to know more about our work and be part of this work to develop technologies that can improve public mental health. Thank you for your attention.